Hello everybody. This is the part 2 of the visual field interpretation. I talked before about some definitions of visual field terms in the introduction in the part 1, and today I'm going to talk about the single field analysis, and I think this will be more than one part. Back to the definition as defined by Straker, the visual field, the simple definition of the visual field is a hell of the vision in the sea of the darkness. You can imagine this is the island of the vision, and this is the area when you can see, and it is surrounded by the sea. The area surrounded this island of the vision is the Black Sea, and only your vision is within this hell of the vision, or within this island of the vision. The sharpest point is the point of the fixation, where is the sensitivity is high and you need lower intensity stimulus to stimulate this point. And you can see also the blind spot, which is in the temporal part. I'm going to talk about the defects in the visual field before going to the analysis of the single field. There are two types of defects in the visual field: scotoma, which is an area of reduced or total loss of the vision surrounded by normal visual field, surrounded by normal seeing area. And the second defect in the visual field is depression, is an area of reduced sensitivity. You can still it can still be seen without a surrounding area of normal sensitivity. There are two types of the scotoma: the relative scotoma, which can be seen only with higher intensity stimulus and cannot be seen with lower intensity stimulus. It is relative scotoma. And absolute scotoma, which cannot be seen with any intensity of the stimulus. Now also I will talk briefly about the physiological blind spot. The blind spot, as you can see in this photo, it is corresponding the head of the optic nerve. You can see the central fixation point in the center, and you can see the horizontal rough and vertical rough, and you can see there is degrees, and this is 10 degrees, 20 degrees, and so on. And the blind spot is located between 10 degrees and 20 degrees. It's 15 degrees in the temporal part of the visual field. It is temporal to the point of fixation, the central fixation point. And the span of the blind spot, it is 5 degrees in horizontal and 7 degrees in vertical, and it's about 2/3 of the blind spot is below the horizontal rough or meridian. Now this is the printout of the Humphrey visual field machine. I'm going now to speak briefly about the names of each part in this printout, and in the upcoming videos I will go through all these in details. So now here we can see the patient data, the date of the birth of the patient, which is very important, and the patient name, the gender of the patient, and the file number, patient ID. Then you can see the right eye or left eye, the sight, and you can see also the single field analysis, or another like guided progression analysis. And you can see here is the type of the program used in the visual field. Here you can see the reliability indices. Here we can see the sensitivity numerical map. Here we can see the grayscale map. Here the total deviation numerical map and the pattern deviation numerical map on the other side. Here we can see the total deviation plot map and the pattern deviation plot map. These are the global indices, the mean deviation and pattern standard deviation. Here we can see the VFI, the visual field index. Here we can see GHT, the glaucoma hemifield test. And we can see the gaze tracker in the bottom of the printout with the probability with B values less than 5%, B less than 2%, and B less than 1%, and B less than 0.5%. Thank you.